Florida Medical Association, helping physicians practice medicine.
Good afternoon, and thank you for joining me here today. My name is Mary Thomas, and I am the Assistant General Counsel for the Florida Medical Association. I'm here today to just give you a quick update on what's going on in the regulatory world. Last week, the full Board of Medicine convened a special meeting outside of its regularly scheduled meetings to take a public position on bills that affect the practice of medicine. I'm really pleased to report that the board's position mirrored the FMA's on all key bills. And most notably, the board voted to oppose the four major scope of practice expansion bills. Those include the bill that would allow autonomous nurse practitioners to practice without supervision in any specialty, not just primary care. A bill that would allow psychologists to prescribe medications, including controlled substances, to all patient populations, including minors. A bill that would expand the practice for physician assistants, and the bill that would allow optometrists to practice laser and other types of eye surgery. So this was really great news. It really shows that the board is moving in the right direction as far as defending the practice of medicine. These are some issues that they haven't necessarily taken a stance one way or another on in the previous years, so I was very glad to see this, and you should be too. The Finance and Process Accountability Committee also met last week to discuss the physician licensure fee schedule. Renewal fees are technically in a reduced rate status at the moment, and that status expired in 2019. Now, the committee and the Department of Health had a discussion about what the fiscal outlook was if the reduced rate remained, and it was looking good. So the committee voted to extend the reduced rate through 2023. Now, as a reminder, this is just a committee vote, so the full board will still have to approve this recommendation. Looking forward, the board will have its regularly scheduled meeting on Thursday, April 8th and Friday, April 9th. And I wanted to bring your attention that the Boards of Medicine and Osteopathic Medicine's Joint Committee on Surgical Care and Quality Assurance will be meeting that Thursday. This is a very active committee typically, but this is the first time that they've met in over a year. On the agenda for them to discuss is definition of office surgery in regards to the limitation on the number of operating rooms that an office surgery facility might need before becoming an ambulatory surgical center. So, the impetus for this is that department inspectors are finding these facilities that are really pushing the limits on what kind of facility they're operating as. And, that's not good for patients. It's certainly not good for the physicians working in this facility if they're actually running an unlicensed ambulatory surgical center. So we'll certainly be following that because we know that if you practice office surgery, this could affect you. The committee will also discuss some topics on temporary closures, and that has stemmed from problems after the executive order during COVID-19 where elective surgeries were banned. Some offices had to temporarily close and they might have missed their annual inspections. And so the department's trying to figure out what to do with these problems. So the committee will be discussing that as well, along with transfer agreements and what might need to be in them because some of the inspections have found that they're not quite up to speed with the rule. So we'll be following all of these issues, and we will definitely let you know what the committee is considering and to ask for your input in case anything adversely affects you and your office. Switching gears a bit to the Board of Nursing, on March 15th, a Florida licensed autonomous APRN filed a petition for declaratory statement with the Board of Nursing, asking the board to allow autonomous APRNs to practice unsupervised aesthetic medicine and medical spas. Now, if you remember, and as I stated earlier, HB 607 that was passed during last year's legislation limits the practice of autonomous nursing to primary care. The petitioner does not assert that primary care services are being rendered in these medical spas or that she even intends to render primary care services, but specifically mentions that APRNs want to perform unsupervised aesthetic procedures such as the injection of Botox or dermal fillers and plasma-rich facials, unsupervised. The petition focuses on the prohibition in 607 on nurses performing surgical procedures, but otherwise completely ignores the primary care limitation. This is absolutely unacceptable, and because of that, the FMA, along with the Florida Society of Plastic Surgeons, the Florida Society of Dermatologists and Dermatologic Surgeons, and the Florida Osteopathic Medical Association filed a motion to intervene this week in that petition. Because the petition is asking the board to issue an order beyond its legislative authority and for some other technical deficiencies that we have found in that petition, we are hopeful that the board will rule in our favor. However, even if the Board of Nursing does rule in our favor or for whatever other reason dismisses this petition, this just really foreshadows, I think, what's to come. We are expecting a lot more petitions or variances and waivers, of nurse practitioners trying to get more and more authority without the supervision of physicians. So as always, we will be monitoring the situation and we will be stepping in to help protect our patients in the practice of medicine. Also, next week I should say, this petition was not filed in time for the Board of Nursing's April meeting, which is this week, April 7th, 8th, and 9th, but will be considered at the June Board of Nursing meeting. So we will absolutely give you an update after that June Board of Nursing meeting. Next week, the Board of Pharmacy will also be meeting, and we are continuing to monitor the Board of Pharmacy's activity, implementing rules related to HB 389. And that was the legislation that allows pharmacists to manage chronic conditions and test and treat for minor non-chronic conditions. For any more details on any of this information, please, FMA members can read the attached article to this video, or feel free to email me at mthomas@flmedical.org. Thank you so much and have a great day.
Florida Medical Association, helping physicians practice medicine.